Hey guys, this is FixerMed. Welcome back to my high-yield immunology review series for the USMLE Step 1 NBME CBSE and NBME CAS examinations. In this series, I will be covering the entire discipline of immunology in a high-yield but comprehensive manner. This will be part 16 of my multi-part video series of doing so. Without any further delay, let's go ahead and get started on today's content. Today, I'd like to open up the presentation by covering different types of transfusion reactions. First, we have the febrile non-hemolytic transfusion reaction, FNHTR. It is caused by donor white blood cell, WBC, activation by recipient antibodies. It results in cytokine release, leading to fever and chills. Coombs test is negative. Leukoreduction can reduce risk. Next, we have the hemolytic transfusion reaction, also known as the ABO mismatch. Due to recipient antibodies against donor RBC antigens. Causes RBC agglutination, hemolysis, and elevated LDH. Presents with fever, chills, and flank pain. Diagnosed with an antiglobulin test. Finally, we have the delayed transfusion reaction. This is the result of recipient antibodies against minor donor RBC antigens. Positive Coombs test. Gradual decrease in hemoglobin post-transfusion. All right, moving on. All right, next topic. Let's talk about transfusion-associated lung injury, TRALI. It presents with ARDS-like symptoms within 6 hours post-transfusion. It is a result of abnormal priming of lung neutrophils reacting to transfused blood product cytokines. It is considered a type of non-cardiogenic pulmonary edema. All right, moving on. All right, next topic. Let's talk about transfusion-associated circulatory overload, TACO. It is also known as transfusion-induced hypervolemia. It is different from TRALI as it's a cardiogenic pulmonary edema. It may occur in patients with heart disease or without cardiovascular history. It presents with symptoms resembling TRALI, typically after 6 hours post-transfusion. All right, moving on. All right, now that we have covered all of the content for today, let's look at some NBME-style, multiple-choice questions to test your knowledge. A 45-year-old woman presents to the emergency department with fever and chills shortly after receiving a blood transfusion. Physical examination reveals an elevated temperature and laboratory tests show an increased white blood cell count. Which of the following types of transfusion reactions is most likely responsible for her symptoms? A. Transfusion-associated lung injury, TRALI. B. Febrile non-hemolytic transfusion reaction, FNHTR. C. Hemolytic transfusion reaction, ABO mismatch. D. Transfusion-associated circulatory overload, TACO. E. Delayed transfusion reaction. All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The clinical presentation of fever and chills shortly after transfusion, along with an elevated white blood cell count, suggests a febrile non-hemolytic transfusion reaction, FNHTR. This reaction is caused by the activation of donor white blood cells, WBCs, by recipient antibodies, leading to cytokine release and systemic symptoms like fever and chills. Importantly, the Coombs test is negative in FNHTR, distinguishing it from hemolytic transfusion reactions. Leukoreduction, which reduces the number of WBCs in blood components, can help mitigate the risk of FNHTR. Therefore, the correct answer is B, febrile non-hemolytic transfusion reaction, FNHTR. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. Left phrenic nerve, C5-C7. The left phrenic nerve does not innervate the liver. B. Vagus nerve, CNX. The vagus nerve provides parasympathetic innervation to the liver, but is not involved in sensory innervation. C. Greater splanchnic nerve, T5-T9. The greater splanchnic nerve contributes sympathetic innervation to the celiac plexus, but is not responsible for sensory innervation of the liver. E. Femoral nerve, L2-L4. The femoral nerve primarily innervates the anterior thigh and leg, not the liver. All right, now that we have covered this question, let's move on to look at the next question. A 58-year-old woman with a history of chronic renal failure undergoes a blood transfusion during a routine hemodialysis session. 6 hours after the transfusion, she develops sudden onset dyspnea, bilateral crackles on auscultation, and a decrease in oxygen saturation. Which of the following is the most likely diagnosis? A. Pulmonary embolism. B. Transfusion-associated circulatory overload, TACO. C. Transfusion-associated lung injury, TRALI. D. Acute respiratory distress syndrome, ARDS. E. Pneumonia. All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. TRALI typically presents within 6 hours post-transfusion, with symptoms resembling acute respiratory distress syndrome, RDS, including dyspnea, bilateral crackles, and hypoxemia. It is caused by an abnormal priming of lung neutrophils reacting to cytokines within transfused blood products. Unlike TACO, which is a cardiogenic pulmonary edema, TRALI is considered a non-cardiogenic pulmonary edema. Pulmonary embolism, pneumonia, and RDS may present similarly, but are less likely in the context of recent blood transfusion and the specific timing of symptom onset. Therefore, the correct answer is C, transfusion-associated lung injury, TRALI. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. Pulmonary embolism. While pulmonary embolism can cause acute dyspnea and hypoxemia, the timing of symptom onset following a blood transfusion makes this diagnosis less likely. B. Transfusion-associated circulatory overload, TACO. TACO typically presents with symptoms of fluid overload and pulmonary edema occurring later than 6 hours post-transfusion, unlike the acute presentation of TRALI. D. Acute respiratory distress syndrome, RDS. TRALI and ARDS share similar clinical features, but the acute onset within 6 hours post-transfusion suggests TRALI as the more likely diagnosis in this scenario. E. Pneumonia. While pneumonia can present with dyspnea and hypoxemia, the timing of symptom onset following a blood transfusion and the absence of other respiratory symptoms make this diagnosis less likely. All right, now that we have covered this question, let's move on to look at the next question. During a routine blood transfusion, a 70-year-old man with a history of hypertension and coronary artery disease receives multiple units of packed red blood cells due to acute blood loss. 6 hours after completion of the transfusion, he complains of sudden onset shortness of breath, bilateral crackles on lung auscultation, and a feeling of chest tightness. Which of the following is the most likely diagnosis? A. Pulmonary embolism. B. Transfusion-associated circulatory overload, TACO. C. Transfusion-associated lung injury, TRALI. D. Acute respiratory distress syndrome, RDS. E. Pneumonia. All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The clinical presentation described is consistent with TACO, which is characterized by symptoms of fluid overload and cardiogenic pulmonary edema occurring typically after 6 hours post-transfusion. Unlike TRALI, which is a non-cardiogenic pulmonary edema, TACO occurs due to an inability of the heart to handle the increased hydrostatic pressure from excessive volume, leading to fluid transudation into the alveoli. This patient's history of hypertension and coronary artery disease increases the risk of fluid overload and TACO. Therefore, the correct answer is B, transfusion-associated circulatory overload, TACO. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. Pulmonary embolism. While pulmonary embolism can cause acute dyspnea and chest symptoms, the timing of symptom onset after the transfusion and absence of risk factors such as immobilization make this diagnosis less likely. C. Transfusion-associated lung injury, TRALI. TRALI presents with acute respiratory symptoms within 6 hours, post-transfusion but is distinguished by its non-cardiogenic etiology, involving abnormal priming of lung neutrophils reacting to cytokines within transfused blood products. D. Acute respiratory distress syndrome, ARDS. ARDS can present similarly to TACO with respiratory distress and bilateral crackles, but it is typically associated with a wider range of pulmonary insults and risk factors than those described in this case. E. Pneumonia. While pneumonia can present with respiratory symptoms, the acute onset after the transfusion and absence of fever or other systemic signs make this diagnosis less likely. All right, guys, that is all I have for the video today. As always, be sure to leave a like and subscribe to the channel for more videos like this if they are beneficial to you. If you have any questions, comments, or concerns, please feel free to type them up in the comment section below. Anyways, guys, this is FixerMed signing off. Be sure to have a great day, everyone. Good luck studying as always, and goodbye.